Those in my life have mostly been women, and it's a sad reality of this days we live in. There are, yes, children fathered, but too many fatherless children.
Thank you very much. Thank you very much. Just before I start, I just wanted to thank the New Zealand Drug Foundation for this awesome event. Ross, the team, really hugely impressed with what you've done here. I think it's you're approaching this issue in a very responsible, considered, detailed and appropriate way, and I think it's been a really, really impressive event, and I'm delighted to have been a part of it. So well done, Ross and the team. So we're having a debate. We haven't really got a debating proposition, but those of you who are aware of our work, I work for an organization called Transform Drug Policy Foundation, which is a think tank. It's a charity, sort of campaign, sort of all three, based in the UK, operating globally, in the area of drug policy and law reform. And we've been around for about 15 years. We have an office in London and an office in Mexico City. And we are advocating for an end to the war on drugs, or the prohibitionist, sort of realigning the prohibitionist paradigm towards a public health paradigm of drug control that includes the legal regulation of production, supply, and availability of currently illegal drugs. So we're looking for alternatives to the war on drugs, specifically including systems of humane and effective drug regulation. So today I'm talking about regulating cannabis, and actually myself and Kevin agree on a great many things. In terms of the broad aims of policy, the need for better treatment and prevention, a lot of stuff around decriminalisation of possession and the need to not persecute users. But specifically, if there's a point of argument, it's around the red line in the sand. Do you have a red line in the sand? Line in the sand, whether it's red or not, around legalisation and regulation. So would cannabis, or should cannabis, or how would cannabis be made available legally to adults within some form of regulated market? And that's what I'd like to talk about. We have published a book. It is available online on that website, tdpf.org.uk. There's copies outside. I'm going to sort of whiz through some of the key points in this book, but I hope you'll be able to take the time to read it in a bit more detail. Because the devil is in the detail, and oftentimes it's nice that we've got half an hour and a couple of hours to thrash that in a bit more detail, but often this debate is in a very polarized media context. It's very much reduced to sound bites, and the detail is important. So do take the time to dig in. Unfortunately, I'm not going to be going into too much detail, and there's a lot of material here. It's 240 pages. How many pages is yours, Kevin? 197, 50 more pages. Smaller print as well, a lot more words in my book. I'm just kidding. But it's important to get into the detail, because actually I think in the future that's where the debate is going to be thrashed out. Okay, so key themes I'm going to whiz through. One is just to introduce where we're up to, because the debate has been moving over the last few years increasingly rapidly, and I just want to summarize that. I want to talk about what is regulation, because there's a lot of misunderstandings about regulation, decriminalization, legalization. What is it we're talking about? I just want to try and clarify some of that. A key theme that's going to run through my talk is learning the lessons from regulation of alcohol and tobacco. Clearly, we've had experiences from full-on prohibition through to completely unregulated markets, and everything in between for both drugs, which provides us actually with a very useful body of evidence and analysis that we can draw on when we move into the debate around whether or not, or how we should regulate cannabis in the future. And finally, a general theme is to talk about evidence-based policy and cautious incremental change. Some people are fearful of cannabis reforms because they think it's sort of something that's going to suddenly happen overnight, that suddenly cannabis will be available in sweet shops on every street corner, and it wasn't before, and this will be a terrible thing. That's really not what we're talking about, and I hope I'm going to be able to make that clear as we move through this talk. So where we're up to, just very briefly, there's a bunch of stuff happening in the cannabis debate that is relevant to this discussion. Medical cannabis, there was some discussion about that this morning. I'm not talking about medical cannabis today, and this book is not about medical cannabis, just to be clear about that. Medical cannabis, I think, is an important issue in its own right, but I think it's important to keep it separate from the non-medical cannabis issue. The two have been often unhelpfully confused and conflated. And there is a brief section in this book about medical cannabis where basically we say, try and keep these two issues separate because they're not the same. There are interesting lessons to come from medical cannabis developments that do feed over into non-medical, and I will be mentioning that. But generally speaking, I think it's important to keep the two issues separate. Nonetheless, medical cannabis is advancing. Lots of countries are introducing medical cannabis provisions of different kinds, and there are lessons we can learn from that, both good and bad. Cannabis decriminalization of personal possession has happened in various forms with various types of civil or administrative sanctions, various different thresholds, in about 25 countries. It kind of depends how you define the term. It's rather a vague term. It can be quite confusing. But again, it is happening. There is a distinct trend moving away from punitive responses to personal possession and cannabis use-based offences towards civil or administrative sanctions for cannabis use. And again, I think it's an important thing in its own right, but again, not really what we're talking about today, what I'm talking about today, which is regulation of cannabis markets. But nonetheless, it's an important trend that feeds into the wider debate. Cannabis social clubs in Spain and Belgium, particularly in Spain, it's kind of happened under the radar. Not a lot of people know about it, but the decriminalization provisions in Spain allow personal home growing of up to 2 plants. And what's happened is sort of informal groups have got together under a series of informal guidelines where what they do is they pool their 2-plant allocation. So say 100 people will get together, they will pool their allocation of 200 plants and give it to a farmer who will grow those 200 plants and then supply the club members with cannabis from that pooled farm. And there's now over 300 of these clubs, some estimates say as many as 700 clubs in Spain. And it's kind of interesting, they're fairly self-contained, they're non-profit, it's a non-profit model, kind of a sort of hippie ethos, but seems to work quite well. The stuff doesn't seem to be leaking out into the wider market. And it's quite interesting. It's a sort of de facto form of legally regulated supply, but it's operating in a slightly strange legal grey area. And the UN hasn't said anything about them. Wayne maybe could comment, but the INCB is yet to comment on cannabis social clubs. So it's sort of possibly just about allowable within international law, but it's not very clear. It certainly is sort of against this prohibitionist spirit, but it may be allowable within the letter. Anyway, nonetheless, it's an interesting model, and it seems to be spreading. So Belgium now has a couple of these clubs, and the Netherlands, about 20 municipalities in the Netherlands are trying to set up a similar system to legally supply the coffee shops, which, as you probably know, have a sort of legal front door, but the back door is still supplied by a criminal market. So slightly strange setup in the Netherlands, which haven't mentioned specifically in this list, by the way. Perhaps most significantly of all, we've got legally regulated markets being implemented in Washington and Colorado states in the US. My guess is that you've all heard about this. Interesting models. I was over in Colorado a few weeks ago. It's interesting to see. They're more commercial models, but still pretty heavily regulated, certainly by US standards. I don't know whether Kevin would disagree with me on this, but it would strike me that the regulation models they're putting in place for cannabis in Washington and Colorado are certainly more restrictive in key ways than what they have there for alcohol and tobacco. So some very interesting developments in the US, particularly significant that it's happening in the US, because the US has often been the sort of cheerleader for the sort of prohibitionist approach. And they kind of were the key architects of it in the last century and sort of key advocates of taking it out to the rest of the world. So it's very interesting that that's happening there. Particularly interesting for me is what's happening in Uruguay, which is rather than at a state level, it's at a nation-state level. They are putting in place a legal regulation model for non-medical cannabis. But it's very different from the Washington, Colorado models. It's more like a state monopoly. So there is the state agency will be the sole buyer from licensed producers, and they will dictate what cannabis products are produced, and they will then provide them to licensed pharmacies to sell to adults who are registered with a government scheme and have a little swipe card thing. So they have a very there's no advertising, there's no promotion of any kind, it's age controls, very restrictive model, government monopoly model, non-commercial, essentially non-commercial, and very different from what's happening in Washington, Colorado. So there's, from a sort of evidence point of view, it's interesting to see these different models. It's going to be very interesting over the next few years to see how these pan out, what bits of them succeed, what bits of them fail, and what lessons there are for the rest of the world. And the world is clearly watching what's happening there. Public opinion, I think it's worth mentioning, public opinion seems to be shifting away from the sort of traditional punitive criminal justice model. Certainly in terms of how cannabis users are dealt with, there's growing support for decriminalization, but also around legalization and regulation, there is growing support. The polling suggests it's reached a majority in the US, which again, I think is very significant in terms of the debate there. But we see a similar trajectory of change in public opinion in most parts of the world. There are some exceptions, but generally speaking, it's moving in favor of reform of one sort or another, certainly decriminalisation, but also in the UK. We commissioned some polling in the UK and found that there was a majority in favour of either decriminalisation of possession or some form of legal regulation of markets. So that is just globally, that would appear to be another trend. There's some interesting things happening with synthetic cannabinoids as well, just to mention very briefly, and the regulation models that are emerging in New Zealand for novel psychoactive substances are likely to include, initially, probably some of the first drugs that get through that system are going to be synthetic cannabinoids. So we are looking as well in New Zealand of having regulation models for sort of fake cannabis. It's kind of weird that you're going to have legal fake cannabis, but actual cannabis will still be criminal. But that's just a kind of sort of perverse outcome of the slightly odd legal sort of grey area that this particular area of policy currently inhabits. And just finally, in terms of where we're up to, the reform debate, as someone who's been in it for more than 10 years now, it does seem in the last 2 or 3 years, particularly around cannabis, there's been a fairly decisive shift in where the debate takes place and the level of engagement. So it's not just moved from theory into reality with actual legalization regulation models being put in place, but it's moved from the margins of public debate very much into the mainstream in terms of heads of state openly engaging in the debate, some of them actually advocating, not a huge number, but it's a new phenomenon. It used to be all former heads of state, now it's actual serving heads of state are now openly talking about this, and a few of them are actually advocating for specific reforms. We've also got very high-level figures in the UN, are openly saying that this is a debate that needs to be had. We saw this year, the Organization of American States, a very high-level multilateral organization, 27 countries in the Americas, produced a report that engaged very closely with the legalization regulation debate, and was, in a very sensible, sort of thorough way, and did not cast it off. It said this is an issue that we are going to need to face in the coming years. We've seen the Global Commission with a bunch of former heads of state and sort of luminaries like Kofi Annan openly advocating for an experiment with legal regulation, and various other academics. It does seem to be moving very much to the fore of debate in key public arenas. So that's where we're up to. Okay, so what is regulation? It's very important just to be clear what it is we're talking about. Decriminalization, legalization often get confused. Hopefully I've already touched on what that is. Decriminalization generally, these aren't unfortunately very clearly legally sort of defined terms, but decriminalization is usually used to refer to the removal of criminal penalties for minor possession and use offenses. The way it's actually implemented around the world varies quite broadly, but that's generally the accepted definition. Legalization and regulation. Legalization is a problematic word that I generally actually try and avoid, preferring regulation. Legalization is a kind of process. It's not really a policy. Legalization is a process of making something illegal legal. It doesn't really define a policy position. That would be regulation. So that how once you've legalized something, you then choose to regulate it is a much more useful place to operate. So I tend to talk about legalization and regulation, or legally regulated markets. In terms of what regulation is, or where it sits in the sort of policy world, regulation of risky products and behaviors is a primary function of government. It's one of the core activities of every government in the world. It's actually very much the norm for risky products and activities in almost all other areas of policy. And a blanket prohibition, an absolute prohibition on any form of production, supply, and availability is actually very unusual in the policy world, even within the drugs world. Alcohol and tobacco clearly are dangerous drugs, but they are legally regulated, not always particularly well, but nonetheless. Pharmaceutical drugs, even things like everything, foods, cars, guns. These things are risky products, and they're often risky behaviors, whether it's driving or dangerous sports and so on, but they're all regulated by government. So drugs actually are quite anomalous in terms of regulation of risky products and behaviors more broadly. In terms of regulation, it's very important to make a distinction between what we're talking about and completely unregulated free markets, legal free markets. Regulation involves putting parameters around the market and how it operates. And if you operate outside of those parameters, those activities are still prohibited and subject to state sanctions of one sort or another. So we're not talking about free markets. We're talking about regulatory models and just that are familiar with almost all other forms of risky products or behaviors. And also, just to be clear, I'm only talking about regulation of markets here, and that is only one aspect of cannabis policy. I'm not specifically talking about treatment or prevention or some of the other important things that have been covered this week. I'm talking about regulation of markets. Clearly, regulation interacts with some of those other things, and I will touch on that, but I'm not ignoring those. Those are very important things, but I'm talking specifically about this part of policy, which is how we regulate the market. Okay, this diagram is kind of, it's a graphic. I don't have a spreadsheet of data to support this. Along the x-axis down the bottom, we have a spectrum of policy options for how we would approach drugs, in this case, cannabis. So on the far left, you've got a sort of harshly enforced prohibition. On the far right, you've got unregulated free markets. And in between, you've got, we move from one to the other. So we've got, moving from ultra-prohibition to the right, you've got prohibition with decriminalization and some harm reduction, a kind of softer, gentler prohibition. Then we move through various options for legally regulated markets, marked as strict legal regulation there. If you keep moving, you get to light market regulation, which is perhaps where alcohol and tobacco are at the moment. If you keep moving further, you get to unregulated free markets. Now, the y-axis up the side is social and health harms. And the general proposition that I'm making is that unregulated markets, whether they're criminal markets on the left or commercial markets on the right, are associated with unacceptable and preventable levels of social and health harm. So harms associated with both use of the drug, but also associated with the market for the drug. And we believe that in the middle, there are strict legal regulation approaches that will minimize the social and health harms associated with cannabis use. And we can see cannabis policy is tending to move from the left towards the center. We can also see alcohol and tobacco policy is moving from the right towards the center. And also NPS, novel psychoactive substances policy, is also seemingly moving from sort of unregulated commercial markets in New Zealand, is a good example, towards increasingly well or tightly, strictly regulated market models. My guess would be that if Kevin was putting this graph up of his worldview, there would still be a U-curve, but the bottom of the U-curve, and I shouldn't put words in his mouth, but I'm going to. The U-curve would be moved to the left, so that the optimum model would actually be something like prohibition of supply, but with decriminalization and harm reduction, a sort of public health approach, but a prohibition on supply. We think it's more to the right, and I think it is interesting in how this debate is now playing out, is that everyone seems to be fighting to be the reasonable middle ground between the extremes of. Kevin tends to characterize legalization as one extreme. I characterize free market legalization as an extreme. and prohibition is another extreme, and we're the sensible, reasonable middle ground. We have regulated markets. But obviously, if your U is somewhat to the left, then you would see we would become the extreme and so on and so forth. But anyway, in a way, it's quite interesting that the debate between sort of Kevin and his constituency and me, maybe my sort of, I hope, reasonable reform constituency, is trying to sort of, it's a tussle over the pragmatic middle ground. And I would argue that legal regulation markets, strict legal regulation markets is the reasonable middle ground, but I'm sure he would disagree with me. In terms of where we can agree, I think that it's important just to establish what the aims of policy are. And if we can agree at least on the aims of cannabis policy and aims of cannabis regulation, it's then a good starting point for engaging in a bit more of a mature, non-emotional debate around which of the policy options is likely to deliver the aims that we all share. I've put these down here. I don't think anyone's going to disagree with any of this stuff. Protecting and improving public health, obviously. Reducing drug-related crime, obviously. They're all obviously. Improving security and development. This is actually an international issue. People can be quite parochial and domestically focused on this. It's important to remember that it's an international market and domestic markets. Maybe not in New Zealand, I guess it's all grown here, but certainly in the US, a lot of cannabis comes from Canada and Mexico. In Europe, a lot of cannabis comes from North Africa and other places. So there are security and development issues involved with it as well that we need to not lose sight of. Perhaps not so much for New Zealand, but certainly globally. Protecting the young and vulnerable, no one's going to disagree with that. Protecting human rights, obviously. And providing good value for money, particularly at a time of financial crisis. People don't want to see money being wasted on ineffective policies. So if we can agree on that, then we can say, okay, which policy prescriptions is likely to deliver these aims that we all share? Now, that's not an exhaustive list. There may be some arguments over which are the priorities in this list, and that's going to differ for different people and different audiences. Other people may have other things that they would like to bring to that. There are sort of some perhaps sort of political or ideological aims that some people have, whether it's a sort of belief in a cognitive liberty or a belief in libertarian, sort of free market libertarianism, or a sort of moral worldview that drugs are evil and we must fight them, or whatever it is. I'm putting those things aside for the moment and looking at sort of from a pragmatic policymaker perspective, these are the things that we need to focus on, which policies are going to deliver those aims. In terms of the elements of a regulation model, this is all kind of obvious, but it's sort of important, I think, to spell it out. If you are going to regulate a market, there are different aspects of the market that you need to regulate. You need to regulate production in terms of security of production to prevent leakage. You need to regulate the products themselves in terms of quality control, potency, price, variety of different products available, packaging stuff, and I'm going to go through all this in a little bit more detail next. You can regulate the vendors in terms of licensing and training requirements. You can regulate the outlets in terms of where they're located, their appearance, density of outlets, hours of opening, and so on. You can regulate marketing in terms of branding, advertising, promotion, sponsorship. And you can regulate access in terms of age controls and explore ideas like licensed user schemes or residents-only schemes and rationing to buyers. These are all things that you can do with a legal market, but you can't do with an illegal market. And that's a key point for me, is that with a legal market, you could have legalization and regulation. It could be done very badly. But at least with legalization and regulation, you're in the position to make those choices and make those interventions. One of the problems I have with prohibition is not only that it doesn't work and it's counterproductive and so on, but we forfeit the ability to intervene on key elements of the market because we have, by default, abdicated control of the market to criminal entrepreneurs. So for me, it's about bringing the market back within the ambit of the state so that the responsible public health authorities can intervene in key elements of the market to achieve those aims. So I'm just going to whiz through these things now. There is a lot more detail, a boring, tedious amount of detail about all these things in this book. $10, but it's available online, so do check it out if you're interested in the detail, which I'm not going to be able to go into in half an hour, obviously. Regulation of cannabis production. So I'm just going to whiz through this and then draw some conclusions at the end. Regulation of cannabis production, key aims to secure production that prevents leakage, to prevent leakage into the criminal market, and to actually secure quality of the products themselves. The photos there, is there a little laser on here? Yay. That's outdoor legal, these are all medical cannabis production. So there are useful lessons from medical cannabis production that we can take over into this debate. That's legal medical cannabis production in some US state, I forget which, outdoors. That's legal medical cannabis production in a secure indoor facility in the Netherlands to produce bedrocan, what's it called? Whatever the Dutch stuff's called. And this one, I shouldn't point a T there, doesn't it? This is legal medical cannabis production in Canada for medical production. It's a state one. It's actually in a mine underground, which might be a little bit paranoid. But anyway, there are choices there in terms of how you go about it and how secure you want it to be. Regulation of cannabis products. There's a whole range of different cannabis products, and we need to be thinking about this in terms of how we regulate them, which ones we make available or not. There's a whole series of choices. There's herbal cannabis, resin cannabis. There's some cannabis edibles. That one on the end's a sublingual spray, Sativex, for medical use. There's a whole bunch of different stuff, and there's a whole bunch of different ways you can use it. So these are key things that need to be looked at and considered as we start to develop our regulation models, and there's a big boring chapter on that in my book. Potency. Clearly, the strength and potency of cannabis is a key risk factor. Our argument is that regulation allows some of those risks associated with potency to be moderated or reduced. Clearly, higher potency products are at least potentially more risky. And although there is a certain degree of titration and modification of dosage control by users, higher potency products would appear to be more risky. Under regulatory structure, you can intervene on that level of risk in various ways. You can restrict potency, like we do with alcohol and tobacco, with alcohol content or nicotine content. You can encourage or guarantee THC-CBD ratios. There was a lot of interesting stuff from over the previous days about risks of CBD-THC ratios and the fact that THC has been creeping up, but CBD has been going down. You can have things like progressive taxation. We've seen that with beer in Scandinavia and some parts of Australia, where beer over a certain percentage has a sort of punitive sort of tax level. There's a sort of progressive tax based on strength. 3 minutes. Oh, Jesus. I've really been waffling. So there's a bunch of stuff you can do in potency. I'm just going to have to whiz through this. Oh, my word. Half an hour. Price, yeah, you can do some stuff with that. Packaging, child-proof containers, tamper-proofing, plain packaging, information on packaging. You can't do that with illegal products. You can do it with legal ones. Regulation of vendors, kind of familiar with alcohol and tobacco. Regulation of outlets, their location, appearance, hours of opening. I've kind of talked about that. Regulation of cannabis marketing. There's been some dumbass marketing of medical cannabis. We need to not be doing that. We need to learn from the mistakes. Basically, we've advocated a complete ban on all forms of marketing, branding, sponsorship, and promotion along the lines of the Framework Convention on Tobacco Control in the WHO Framework Convention on Tobacco Control provides a very useful model for this in terms of marketing controls. Access to markets, just very briefly, controlled availability is not the same as increased availability. Kevin may would differ with me on that, but it's an important point. Age controls, we can talk about that in questions perhaps. Other market access, membership club models, residence-only models, rationing of sales. Conclusions, few. Close scrutiny and evaluation on a range of key performance indicators is obviously important. We need to put evidence-based. Cannabis policy, drug policy generally has been very much politically and ideologically driven for an awful long time. We need to rebuild evidence-based scientific approach back into the heart of policy with very clear evaluation and clear performance indicators on all of those different areas that I've also briefly touched on. The key risks that we've identified in this book and tried to address is the risk of over-commercialization. We need to learn the lessons from mistakes we've made with alcohol and tobacco and not repeat them. I think we actually have a very unique opportunity here, unlike trying to kind of reverse engineer the public health disaster with alcohol and tobacco by trying to remove branding and introduce controls to a deeply culturally entrenched market, that, as it's happened with tobacco. With cannabis, we actually have a very interesting opportunity, very rare in policy, very almost unique in drug policy, to build the system that we want kind of from scratch. And this time we owe it to our communities to do it right and not make the mistakes we made with alcohol and tobacco. The key risk is over-commercialization. The key risk is over-commercialization. There is clearly a conflict of interest between private profit and public health, and we need to make sure the public health people are driving this bus in the future and not the money interests. And we can do that. And maybe they're not going to do it too well in the US, but they are going to do that in Uruguay. And we need to learn those lessons and do it right. Obviously, adequate capacity. There's no point in having a regulatory framework if you're not going to enforce it. And getting the balance right is critical. If the system's too restrictive, it won't achieve its key aims by meeting demand. If it's not restrictive enough, you have risks of over-commercialization and increased use. And we advocate in this book for both practical and political reasons to begin with a more cautious, restrictive model and move forward from there. Thank you very much.
That book again is the bigger, costlier book, isn't it?
It's free online.
Free online. Now, Kevin Sabet from Smart Approaches to Marijuana. Yes, thank you.
Thanks so much.
I'll give you a 10-minute warning. So
that would be good.
More of it. Well, I know. I was trying to get your eye for the first couple, so, you know.
Didn't work well. Sorry, maybe we can just turn this off for a second while I do the intro. Otherwise, we'll skip ahead if that's possible. But thank you very much for the opportunity to speak in front of you, Steve. It's really a pleasure to be here together. I will say for the record that my book is $15, not $10. So it actually does cost more. We just were lucky to find a grant to provide it to the attendees of the conference. I just want to, we're even going to argue about the cost of our book. Isn't that amazing? No, I just want to thank all of you for being here. I think, you know, one of the things, and it's really actually a pleasure to do this, really what's more of a discussion rather than a debate, I think, with Steve. Really in the spirit of, you know, one of my first days at the White House, President Obama told a small group of us that you're going to be, and since 2009, a lot of battles coming ahead with healthcare and other things. We can disagree on a lot of the different policy issues, but let's disagree without being disagreeable. And I think that's something I carry with me, and I think that's something that I think Steve does too, and that's why it's a pleasure to do this. I also know that many of you have your minds made up, and that's fine. That's good, but we can still have a rational and civil discussion about this issue. One of my things I did at undergrad, I actually went to University of California, Berkeley, in California. And because of a lot of different issues, I won't take my time talking about too long, but we started a group called Citizens for a Drug-Free Berkeley. It was about as popular as the Coalition for a Wine-Free France. But it taught me that even folks who had their mind made up, if they were smart enough to have an open mind, they might be able to learn a thing or two, and vice versa. So that's sort of in the spirit that I'm able to talk to you about this today. So if we can go ahead and start. I think Steve and I do agree on actually a lot of different things. First, I think we agree that cannabis can be harmful, especially for kids. We both agree that most people who try it will not become addicted and actually won't have harms. That's the case with all controlled substances, including heroin, cocaine, tobacco, and alcohol, that most people who ever use will not continue their use and addiction and have negative consequences. It's the small number of users that we have that at least, certainly myself, I think Steve too, would have an issue with causing great harm in society. I think we both agree that we don't want to see widespread promotion and commercialization of any substance, including alcohol and tobacco, including cannabis if it does become legal. We also agree that we don't want to see the widespread incarceration or really sort of outlandish punitiveness, some of the things we know going on in the Middle East and in Asia and other parts of the world, that we don't think that either of those, that approach is also something that we would agree on. And actually, I would argue that and I put a slide on here, I think, our two books actually have a lot to agree on. I think that at the end of the day, a policy exercise is about weighing those different harms and figuring out which weigh more than others and which pros outweigh the cons. And we obviously, at the end of the day, come out to a different conclusion. But I think that we actually agree on what a lot of the harms are. So The crux of my issue with legalization and my issue with Steve's approach and others' approaches is that if only everybody acted in the responsible, detailed, meticulous, actually, and I've read half of this book so far, Steve, way that is presented by Transform, we might actually not be on such opposite sides of the spectrum. If I thought that those market forces could be controlled, if I thought that everybody was Steve and his competent colleagues, hold on, I wouldn't have as much of a problem. The reality is that isn't the case, unfortunately, for public health and safety. The reality is the case, certainly because of constitutional and cultural issues, not just in the United States, but around the world. I think the reality is once this is let out, once legalization, full regulation, whatever you want to call it, goes forward, we're not going to be able to control the market forces and the other forces, cultural forces and otherwise, that I think are going to sort of send us on a fast track to having a lot of public health and safety harms. And I think rather than look at sort of say, well, now we have a clean slate so we can do something about it, well, I think we had those clean slates 200 years ago and 10,000 years ago and at other times as well when other substances really came into the mainstream. And our only two examples that we can draw on, right? Uruguay has not sold one joint yet. We don't know what's going to happen. Colorado and Washington, they've legalized for a year, so home cultivation, we have some experience with some normalization in home cultivation that I'll talk about a little bit, but there is not a store that has opened there. Our real examples are medical cannabis in the States with retail sales, the Netherlands to some extent, and I really think globally, alcohol and tobacco. I mean, really, because those other two examples are in certain geographic areas. Globally, alcohol and tobacco. And when we look at alcohol and tobacco, there are a couple things that we see for a variety of reasons. I would argue legal is just one of them. Certainly cultural is a huge part of it, but also cultural and legal are connected. The use levels for alcohol and tobacco are just globally are so much higher than any of our illegal drugs. And we can argue that cannabis, which is our discussion today, or some other drugs, have very rich cultural histories dating back to 10,000 years like alcohol, but the idea that they have the widespread acceptance in most of the Western world, I think is a bit of a stretch to compare that to something like alcohol and tobacco that are used just in such a greater amount. And the experience, not just in the US, right, but around the world, is that there are industries, and sometimes governments, by the way. I mean, the idea that, well, it's okay if a government collects money. Well, no, then they still have an incentive to collect tax revenue and otherwise increase use. So actually, I would amend the slide by saying industries and governments, frankly, really have an incentive to promote addiction. Why? Well, because you only make money in this business among the heavy regular users, okay? So the alcohol industry, if any of you are the kinds of people that like to drink a glass of wine with your dinner at night, or a few beers when you watch, well, it's rugby here. I mean, every single channel is rugby in my hotel room. I was going to say football, but it's rugby. Okay. The industry, the alcohol industry, really couldn't care less about you. You're really unimportant to them. The people that are very important to the alcohol industry, because they provide their profit, are this minority of users that consume the vast majority of the volume, right? So 20% of alcohol users drink really irresponsibly, and they probably should not be drinking. 80% don't. Very similar to most of our other illegal drugs, right? The 80-20 rule. But that 20% consumes 90% of the volume of alcohol. And by the way, that carries for all our illicits as well, the minority of people that consume. So that means that you do have an incentive, if you're a government or an industry, to make sure that that group continues to use irresponsibly and continues to incur harm. You want to incur harm. That's the only way, if you can do so under the radar, that you're going to be able to survive. And the way you start to do that is you have to target kids. Okay, this is the sort of addiction disease model, you would say, is a pediatric onset, right? It starts young. Yes, 1 in 11 cannabis users, if you start as an adult, become addicted. But that number rises to 1 in 6 if you're 16 and 1 in 4 if you're 14. So that means you have to start young and you have to target kids. The idea that we're going to have really nice regulations that protect, well, then there will not be incentives for any of these, whether it's industry or government, to keep going on this. So, I mean, this is in the U.S. Actually, the in terms of the use rates, globally, scale-wise, is very similar in terms of the proportions, right? About 4 times as many people who smoke cigarettes and smoke marijuana, and about 6 times as many people who drink than smoke marijuana. Just sort of illustrating that. Okay. And so that's why, the incentives that I see to increase use is what does scare me. And I realize that there are some responsible ways and that I think might be able to curb use that have been presented. I just wish everybody, including the billionaires who are funding this in the US, who have funded this globally, would be listening. Because sadly, the profit incentives for those folks and for the people getting involved in the business, they have no reason to listen to that, sadly. So when I see a beer ad that says enjoy responsibly on the bottom of it, I laugh. Because if everybody enjoyed responsibly, there would be no alcohol industry. You can't survive with responsible drinking. The taxes in the United States today, and I would venture it is very similar here, and I've been following the alcohol policy. You've been trying to pass an alcohol bill that seems as reasonable as you can get, and it's failed every single year for all the 3 main provisions, is what I found, because there's an industry, and there has to be. The taxes today are about 1/5 of what they were then during the US-Korean War, which is during the 1950s, when you adjust for inflation in the US. And trust me, when I was in Washington, D.C., and we actually had, at the drug czar's office, we deal with illegal drugs. Well, alcohol is an illegal drug if you're under 21 in the United States. So when we actually tried to do alcohol education, because we said, look, we can't just focus on marijuana. Kids are drinking at much higher rates. So we need to do something about this. You should have seen the response from what we would call K Street, which is our lobbying row, right? The lobbying street in Washington. I mean, good luck with that, is really what folks said to us. And they were right. It was a pipe dream to think that we would even be able to try and implement some restrictions on an industry that had gone wild. I think, so this point goes more to, well, there are negatives to current policy. I mean, this is not, neither of us are saying that there are no negatives to our preferred policy choice. That's one thing that I'm glad we're able to do in this venue as opposed to CNN for 2 minutes, which is normally what it is. I think that the gains promised from cannabis legalization, frankly, are very modest compared to the potential gains, but also potential risks if we were to legalize all drugs. And actually, that's actually, again, another reason I respect Steve is because he said it this morning, he wears it on his sleeve, that this is not just about cannabis in terms of the arguments that are being made. Obviously, in the book it is. But in terms of the overall arguments of the organization, it's about cocaine, methamphetamine, and heroin. Now, that may sound scary, but at least it's honest. See, in the U.S. right now, the leaders of this, which really are driving the global move towards legalization, it's sort of, they're not mentioning those other drugs right now, when in reality, it really is about more than marijuana. And it really has to be if you want to do something like get rid of cartels. The Mexican cartels gain 15 to 20% of their revenue from marijuana. Frankly, we produce much better bud in the U.S. than the Mexicans do. Good old American ingenuity, I think, with the high THC rates. And so if we did want to diminish their power, well, we'd have to do a lot of other things. We'd have to legalize, first and foremost, human trafficking. Okay, let's be very clear about that. Then cocaine, heroin, methamphetamine. Then we'd get to the kidnapping, extortion, and all the other fun little things. And then we'd have to think, well, okay, so we've tried to get rid of, so where are those guys going now? They're going to go become ice cream men? I mean, what about the structural issues in countries like Latin America, Mexico, and other places that are the main suppliers? I think it is very simplistic, and I'm not saying Steve says this, but the debate is dominated by this, that the idea that we'd be able to, that these folks wouldn't move to something else if we would legalize cannabis. I also think that in a legal market, especially the responsible one that Steve presents, you're going to have every incentive for a black market to remain. Why? Well, there are very, very reasonable restrictions that we might all agree with. We all agree probably that we wouldn't have marijuana for minors. I think we agree with that. We agree that we wouldn't want, maybe 80% THC butane hash oil combustion that is now being consumed. And actually there was a festival for it in Colorado the other day to celebrate marijuana legalization, which does send and has sent dozens of people to the hospital when you inhale 80% THC wax. We would probably agree that that shouldn't be sold. And we would put all sorts of other restrictions that are very reasonable and nice and wonderful to put together, in an office in London or Boston that we would agree on. But the reality is then, well, great, there's that black market then. Trust me, they've been there for 50 years. They'll find a way to ingenuate. They'll find a way to basically say, all right, well, we'll sell to the kids under 21. Well, fine. We've been doing it for 50 years. Why are we going away? You can't get 15% THC in this community? We'll provide it for you. Oh, your responsible community is taxing it to pay for healthcare and education? Great, we'll undercut the price. The point is, drug policy is difficult, it's hard. It's really hard. There are trade-offs that are difficult. I think, again, Steve is one of the few people that I think recognizes those difficulties. He might say that I'm one of the few people on the pro side or the anti side that recognizes those difficulties. But the reality that you're going to have a very simplistic solution to a complex issue, I think, is something that we need to be very wary of. And so these are just a couple examples. So for me, I'm concerned about this. I'm concerned about the Marlboralization of marijuana, and it's starting. This isn't a theory. This isn't like, well, we can control it and do this like we did medical. No, it's already started. And we sort of laugh at it because, I think a lot of us, our thought of marijuana and users of marijuana and the market is, our nice neighbor who likes to smoke once a week after work. Big deal. Or my quirky uncle who likes to smoke a few joints every month. Why would we want him to go to jail? He didn't hurt anybody. I certainly wouldn't want him to go to jail. My artsy neighbor, very creative person, who likes to smoke marijuana. Maybe it helps her. I have no idea. Good for her. She's 40 and probably can maybe handle it, as long as she's not driving and doing other things. But for me, that isn't what legalization is about. I couldn't care less about that situation. As we say in the U.S., live free or die. I mean, go for it. What I care about is this, which I think is the reality despite the best intentions of others to control it. What record do we have of controlling it? When I look at, this is a real magazine cover, The Pot Entrepreneurs, based on essentially a group of people that the Wall Street Journal has talked about, the Yale MBAs, right? So, our image of the cannabis user and consumer is, stereotyped with, like we went on the show the other day and the woman, the host of the show we were on said to Steve, well, Steve, I was expecting you to come in, dreads and like whatever. And Kevin, I thought you were going to be like Mr. Fox News, but you're both kind of not either of those things. But there are those preconceived notions. Well, that's not what today's pot entrepreneur, someone who's a legal entrant in the business looks like. He looks a lot more like this guy, who sort of actually looks like me from far away. Never noticed that before. Doesn't even use cannabis. Yale MBA, smart guy. I actually think the irony is that the baby boomers who tried to legalize in the 70s, the normal folks in the US, the irony is those folks are so anti-corporate, but their efforts, which have spurred a lot of things that are out of their hands completely now, all right? Normal doesn't control in the US, these guys, totally different. Their efforts have ironically spawned these, what you might call ganjapreneurs, I've heard. They're meeting at investors clubs. They have already raised millions of dollars for an ancillary business around marijuana. So again, this isn't about my right to grow a couple of plants and leave me alone in my basement and I don't have kids and I'm not driving, so get out of my hair. No. It's about this corporate issue. And when we look actually at the real tobacco industry, the tobacco industry that, frankly, is responsible for 500,000 deaths a year in the United States, billions, trillions and trillions of dollars of cost and human suffering, #1 preventable cause of death in the world, we actually know they have machinations on marijuana. They've talked about it before. I'm not going to read the quotes here. You can read them yourself. They're in the book. There is evidence of it. And if the past is any indication for the future, we know now in the US, one of the few, we have uncovered all of the tobacco documents. These are the same people that said what I hear a lot from marijuana advocates. We want to do something very responsible for those 21 and older, sir. We would never target youth. And then literally the next day, when you look at the dates, You could match them from the Senate hearings to these memos. The next day talking about how unfair it is that they can't target young users because they said it themselves. 70% of people start before age 18. Only 31% start after age 18. That's 70% of their market. You're telling me I can't target those people? When the Winston man, the model for Winston cigarettes, the symbol of American individualism and ruggedness and like independence and freedom, when he, after becoming addicted to cigarettes by age 35 and now has seizures and suffers from every single pulmonary issue you could talk about, he's gone from smoking like I don't know how many packs a day to now being an anti-smoking crusader. And he sometimes is in a wheelchair when he does that because of his smoking. At the end of one of his modeling shoots, there were a lot of cigarettes around for the picture that they were taking for the pictures. At the end of one of the modeling shoots, he told the executives there at R.J. Reynolds, I guess you guys want to take these cigarettes back, right? Because I was sort of looking at them. Can I grab a couple, take a couple home? And they said to him, basically, we don't smoke this shit. We sell it. We just sell it. We reserve the smoking for the poor, the black, the young, and the stupid. And this was on a congressional record that this was said. So when I look, and then we can look at the different targetings of Apple and sweet flavored and how to get girls to smoke because you can make it look like it's young and fresh and you can lose weight, and we can look at all of that. And when I look at that and I compare for the lack of a better term and excuse the pun, the seedlings of the marijuana industry, that's what scares me. When I see the National Business Expo, which costs $15,000 a pop to go to, which happened less than a month ago, 3 weeks ago, in Seattle, and I go and read the people who are there, and I do look at the multinational corporations, I do look at the consultants that have literally been consultants for big tobacco, that is the reality, folks. We can talk for ages about the proper thing of packaging and producing and products and indoor and outdoor and restrictions and young people and THC and CBD, and we can do multiple products because we know CBD is better and we'll increase the CBD, and we can do vaporizing because that's for naught. Because the reality is, I think, we already have examples with the vending machines, 10 minutes, with the vending machines. I mean, the joke about, I don't know if you have vending machines here, but in the US, it took 50 years to get rid of vending machines, tobacco vending machines. The Surgeon General came out with a report in 1964 that said tobacco kills. It took like 35 years to even get that into any legislation and acknowledgement. And now we're ushering in marijuana vending machines. So you can't find a tobacco vending machine anywhere anymore. But we're sort of okay with these because, well, they're run by businesses who give money to politicians. That's kind of just how it goes. That is the real world. And I don't think you can just say you can say it's the stupidity of the US in some way, right? It's our history of excess, right? We use the most drugs in the world. We also kill the most people in the world. We also, make the most money in the world, have the most, Google, Apple, but we also have the, most inhumane, et cetera, et cetera. It's sort of like the worst and the best, I think, in many ways. And so we see that here in terms of the worst being the runaway train of commercialization. And we're seeing that already with medical. We're seeing the ads. We all agree this is stupid. Well, that's nice, but that is the reality. I mean, we can agree that we don't like it. Well, that's wonderful, but we're not there actually paying the politicians to allow us to put this in stores. And I showed some of this yesterday, but it's just to illustrate the fact that, remember, medical marijuana started as a movement among 24 AIDS patients who couldn't eat and were dying. And now it's turned into grape soda with, a monkey on it, a skeleton monkey, and this guy was saying that you should have a ring pot. So it does get out of hand pretty quickly, unfortunately. And I don't think it's only an American phenomenon. We also have, and so it's sort of like, well, why are you voting for it then? Great. Don't you know that that's stupid? What happened in Washington and Colorado? Well, when you have billionaire financiers in an industry that come in and, with $6-7 million in a state and bombard your state with commercials for 3 months, promising everything from rainbows to unicorns, if we legalize marijuana, well, you'll have a lot of people, very rational, reasonable people convinced that don't use. These are people that do not smoke marijuana, who are saying, yeah, you know what? They told me we can pay for public schools and our healthcare system, which is notoriously bad. Well, all right, well, how have we done that with alcohol and tobacco? That's our only example. And by the way, gambling, the lottery. I don't know what the issue with the lottery is here. When the lottery was passed in the United States, it wasn't because people like to play scratch cards. It was because it was promised to solve public education. Well, and if you haven't checked, the last time I checked, public education has certainly not gone too far since that in the US. I don't know what it's like here or in your country. But what I can tell you is this is consistent with data from most of the Western world, that for every dollar in alcohol and tobacco tax and revenue gained, we spend between 5 in some countries in the US, 10 in social costs. So yeah, you might this year be able to fill your little legislative coffer and say you're going to put money in for treatment. How's that going with alcohol? Do you have good comprehensive alcohol treatment? Everyone can get it with the tax revenue? What about cigarettes? So, I think these promises are often unfulfilled, but they sound really good to a reasonable person. Like, again, these are people like my aunt, who, she grew up during Reefer Madness. I think she loved it. And yet she asks me the other day, I've been hearing about medical cannabis for my back pain. I was like, what? She's never had a drink in her life. This shows that this political movement, kudos to not so much Steve, sorry, I can't give you credit, but to, George Soros and others and I know he's sponsoring this conference, and I appreciate that. And does a lot of good things, by the way, but also bad things. We can talk about that later. This has been the movement. And so, the other thing that I like to, which I think is really incredible, when you think about, if only we treated this like alcohol, we wouldn't have criminals, right? We wouldn't incarcerate anybody if only it was treated like alcohol. Well, in the States, I looked at the data, not for violent-related alcohol assaults. Forget about those. We're not even going to go there. I'm not talking about cannabis as the same violent-inducing drug as alcohol. No, it's not, and we can put that aside. But regulatory arrests related to this legal regulated market. What does that mean? Driving under the influence, public using, public intoxication, and selling to minors, right? All things that we would reasonably want to control if marijuana was legalized. Well, because the prevalence is so much greater than marijuana, because it's available, legal, and really cheap and normalized, all things that happen under a regulated market, by the way. There are 3 times as many people going to in the criminal justice system. We were talking about incarceration yesterday. 3 times as many for alcohol than cannabis. In the home of the war on drugs, America, the most punitive country supposedly in the world for cannabis. It isn't. Many more punitive countries. But again, even if your stated objective, forget about the health part, is just criminal justice, we're not, I don't think, going to be getting too far on that. I went through a lot of this yesterday, but we have other examples in alcohol and tobacco. We actually do have Colorado post-2009. Anybody with a pulse can get marijuana. And, that's celebrated. That's not a controversy. The advocates, that's a victory. And, when the number of card holders in 2 years rises from 1,000 to 100,000, and it's not because of a sudden rash of 32-year-old white males getting cancer. This is an example, really, of the, and I showed this data yesterday, but the early data isn't promising. 3/4 of the kids in treatment in Denver, according to Addiction Journal, just published a year ago, 3/4 of them got their marijuana from a medical marijuana dispensary, a regulated system. You were supposed to go to a doctor and have cancer. That's why people voted for it. They didn't vote for it because they have sympathy for the 32-year-old white male that has a little pain in his ankle or back. They voted for it thinking it was for the cancer or AIDS patient. Well, 3/4 of kids now are getting it. We went through this data yesterday. Actually, one of the early things we are looking at is the data with crashes. Now, we do need to compare this with other states around, and I wouldn't follow my sword on this one. But every indication, every other cause of car crash has gone down in Colorado for the last 2 years except one, marijuana related. If you look at video or tapes of advocates in the US talking about a regulated system, they lauded Colorado for the last 10 years about how wonderful it was. It wasn't California, it was Colorado. Well, they just did 2 big independent audits showing that there is no regulation at all. They thought they were regulating it, but they weren't. There wasn't any way to, I'm not going to go into the details of their conclusions, other than these complete nonpartisan independent reports, 2 of them, showed that forget about regulations. And now the article comes out last week, pot problems in Colorado increase with legalization. This is before a store is opened, by the way, which is really more my worry. This is actually surprising. It's the normalization part of it. It's the year where kids think it is acceptable. And it's still illegal to sell it in a retail store. This is the impaired driving trends that just came out last week in Washington State over the last year, the 50% increase. Now, we're still figuring out the year hasn't ended, and how does that compare with alcohol? And we're looking, but it's been a pretty large increase in 1 year only of people essentially testing positive for THC, indicating, yes, they might have had problems driving, but more importantly, that the use levels have elevated, which is what a lot of people thought. So the last 2 minutes is just focusing on kind of going from that to sort of so great, Kevin, what is the answer then? The reason why someone like Patrick Kennedy, the son of the most liberal politician in the US in the last 30 years, literally, is joining, the public health associations in the United States and a lot of people from the right actually coming together on this, is because we do think there's a better way. And we do think there's a better way other than something that is unknown and frankly just risky. It's a gamble of legalization and current policy. I'll talk more about that and what I mean, but there are, a few examples about how to address current policy in my last 30 seconds. Users, shouldn't be incarcerated. There are bad tales in certain southern counties in the US of people getting apprehended that they shouldn't be. And we need to address that. We do need to address the disproportionate impact of arrest. Wonderful, let's do that. Why we have to address that by legalizing is beyond me, or regulating, because that is a risk. We don't know what's going to happen in Uruguay. We don't know what's going to happen in Colorado and Washington. We have early indicators. We don't know. What I would say is, and by the way, the idea, we're so myopic with drugs and cannabis. What about the non-legalization reforms? What about just like decent public housing and education in certain communities, right? What about actually restructuring the healthcare system? What about reforms in other systems that we have? That's a long neglected view. We tend to have myopic views that drug policy is the #1 driver. There are other drivers. The point is this is complicated, really complicated. And I do think it's a simplistic solution to either say lock them up and throw them in jail, war on drugs, incarceration, just say no. And I also think it is simplistic to say, well, we can regulate and have a legal system. So thank you very much.
I like how you tell me it's going to be 30 seconds more. That's very clever. It was. I'm going to use that in the future.
I was running away from you because you were following.
I could see that. That was very good. Very interesting. Thank you. Time for some rebuttal. We'll have 10 minutes of rebuttal, and then you can talk for another 10 minutes,
yeah.
and then we'll open to the panel.
Thank you. Thank you for that, Kevin. I might.
You're welcome.
Might stand here. Lots of interesting points you make. Kind of frustrating because I don't want to go through just picking holes in little bits and bobs. But there are a few. I do want to draw some bigger conclusions. But just briefly, there are a few. I think one of the frustrating things for me is you've made some arguments where you're kind of arguing not with what I'm saying, but with what some legalization advocates may or may not have said, or maybe what some people have written in comments on blogs or something. But it does feel like there's a certain, what I would call straw man arguments that you've made that I think I'd like to respond to. So just to whiz through a couple of those before I make some broader conclusions. One was that you were saying that, and I think you said that in here, but unfortunately I haven't read it because I only got it today. You said that the cartels, if we legalized marijuana, the cartels wouldn't go away. We really have never said that, and I'm not really aware of anyone sensible who has said that. What it would do is it would reduce their profits a bit. That's not brilliant. It doesn't make them disappear, but it's still a good thing on balance. And it's not a panacea. Regulating cannabis does not create a utopia. It just makes things a bit better. And if the cartels are slightly less powerful, that's good in my book. It certainly doesn't eliminate them. And I really do not understand the argument about legalizing human trafficking. I think that's tying on something that's ridiculous. It's not an argument anyone's ever made. So I would reject that one. The linked argument you make about that the black market will remain, we've been very clear about that in the book. So again, I feel it's sort of you're arguing with a straw man rather than me. Legalization and regulation of cannabis does not get rid of the black market entirely, but it reduces it significantly, and that is progress, because the illegal market, criminal market, is a harmful social phenomenon, and a regulated market is a less harmful social phenomenon. So we're talking about progress, we're talking about making things better, not creating a perfect world, and we've never claimed that. And actually, there's quite a lot of exploration in the book about how we need to balance conflicting priorities around price. It was one of the slides I had to whiz through because I've been waffling on too much. But there are conflicting priorities between dissuading use and dissuading criminal markets. But at least with a regulatory model, we're in a position to make that call and decide what our priorities are and set the balance where we think it's going to be most usefully set. There are no perfect solutions, and you do have to make compromises, but we can do better than where we are at the moment. I think a more significant issue in some ways is the issue of big tobacco. I feel that perhaps maybe it's because you have a US-centric view, and the political culture in the US is kind of uniquely market-oriented. There is this issue about commercial freedom of speech and First Amendment rights. I feel that if the First Amendment is being used to allow commercial freedom of speech to promote drugs to children, that's a misuse of the First Amendment, and we should fight it. And I think you should say that. And if the law is being misused, or if law is bad, then let's change it. And that's a fight worth having, and it's one that we should do. So we are law reformers, or I'm a law reformer. And if the law is being misused or it's bad law, then let's get it changed. And I know it's not easy to change the Constitution or the First Amendment, but if it's doing bad stuff, then that's a fight that we need to have. If the political culture in America is bad, then we need to change it. And it's not something that happens overnight. Maybe it's something that needs to happen on a generational basis. But also, on a bigger picture, is that the rest of the world is not necessarily like the US. The US is almost uniquely market-oriented and uniquely freedom of speech, commercial freedom of speech-oriented. We don't have advertising of pharmaceuticals to patients outside of the US, except in New Zealand. For shame. I mean, it's a disgrace, and it shouldn't happen, and it needs to change. I don't accept that these things are written in stone. I don't accept that laws can't be changed. And if the laws are bad, then let's change them. The bigger issue around big tobacco, I think there's actually very interesting experiences with big tobacco, because actually even big tobacco isn't really like big tobacco anymore. Tobacco regulation has been, in many ways, a very positive public health development over the last 20 or 30 years. We've seen increasing tiers of regulation introduced to tobacco, even in the US, maybe not quite as much as anywhere else. We've seen regulation of smoking in public places. We've seen health warnings on packaging. We've seen plain packaging introduced in Australia, and it's about to be introduced in a bunch of other countries around the world. In the UK, we've seen a ban on displays behind the counter. We've seen a ban on vending machines. We've seen the age access increase from 16 to 18. And the net effect of all that has been to increased regulation and better regulation, moving from the left of my made-up graph to the middle. We've seen a reduction in use and a reduction in health harms. We've seen public health advances through better regulation, which is what we're talking about for cannabis. We're just starting from a slightly different place. So I don't accept that big tobacco free market models are inevitability. And I think the experience with better regulation, improved regulation, and bringing big tobacco to heel over the last 20 years suggests it's not an inevitability. So I look actually at what's happened with tobacco policy and take some comfort from it, that actually we can fight big corporate interests, we can fight big tobacco, and we can do better in terms of how we regulate and the public health outcomes that delivers. You were putting up a picture of a marijuana Marlboro packet. We're introducing plain packaging. One of the great things about regulation is if you see a problem like stupid promotions or irresponsible packaging, whatever, you can stop that. It's like, look, there's a problem. Here's a solution. Regulation. Yay! It's not. You can address those problems with sensible regulation, which is what the book's about, and it's what we should be doing. So I'm afraid I don't really buy into that either. And yes, more people use alcohol and tobacco, but there are legal drugs that less people use. Solvents aren't used nearly as extensively as alcohol and tobacco. And amongst illegal drugs, there are illegal drugs that aren't used nearly as much as marijuana. So I think taking some legal drugs and some illegal drugs and putting them next to each other and going, aha, look, different drugs are used in different ways by different people for different reasons, and it's not a reasonable comparison, especially because alcohol and tobacco have been aggressively promoted as sort of lifestyle products over the last 100 years in ways that haven't happened with marijuana and won't happen if we put in place the appropriate regulatory structures. So it's not a reasonable comparison, and I'm afraid I have to reject that argument as well. But just to finish, I don't know how much time I've got left, but I'm going to finish anyway. It seems like you're saying that were marijuana legalization regulation to happen, something more akin to what Transform's talking about, with non-commercial models and the de-incentivization of commercial pressures and so on, you would have a lot less of a problem with it. And that's very interesting to hear and very welcome. I don't want to put words in your mouth, but I don't accept that the commercial models, big tobacco model idea that you're proposing is the only way. There is another way. This book describes what that is. I think what's happening in Uruguay is very close to what's described in this book. I think some of the lessons from the cannabis social clubs, non-commercial models in Spain are also provide some very useful lessons. There is another way, and for me, it's behoven on us that we get it right this time, because there is an inevitability to this reform. I mean, I may be trying to speed it up somewhat. You may be trying to slow it down. Probably neither of us are going to be able to stop it happening. It is happening. It is going to be upon us in the next few years, whether we like it or not. And we need to make sure that we do it right. So some of the sort of scaremongering that you've done doesn't come to pass. They are realistic fears, but I think if we do it right, we can stop that happening. For me, that is a fight worth having, because it's a fight that we have to have, because this is an inevitable policy progression. We are moving into a post-prohibition era, and we need to make sure that we do it right. It's a fight worth having, because if we don't do it right, there will be costs, and they're avoidable costs. And we know what those costs are, and we can make sure that it doesn't happen in the future. But that change is coming to us whether we like it or not. So let's make sure that when it happens, that we do it right, and we can achieve the aims that we all want to see. Thanks very much.
Thank you. Well, a couple things I want to emphasize. First, I think there is this, and it's a political strategy for all political issues, of which this is one, of this pushing this air of inevitability, that globally there is an inevitable push when you sort of get on the train or get off of it and go take your place with the backward-thinking Neanderthals while the rest of us progress. I actually think, sort of ironically, I'm being accused of having an American-centric view. I actually think that's a very American-centric view. I think when you look at public opinion in most other countries in the world, you don't see that level of support at all. In fact, even in Uruguay, you do not have majority support. There was such low support for what they're doing in Uruguay last year that the government funded a propaganda campaign about how wonderful this is going to be, and then they were able to reintroduce it the next year. Still, they don't have a majority support. In fact, the public health and the doctors, the public health community, which I think we're saying we want to base this on public health, the public health community, like the minority leader in Uruguay, who's a medical doctor, not the president or anybody else, are very worried about this, and they were very much against the reform. Of course, they were in the minority, but even there, where this is going ahead on a state level, the New Zealand Drug Foundation commissioned the question about not legal, nothing close, I think, to what's in here. By the way, the question was, correct me if I'm wrong, decriminalization, probably a lot closer to what I'm talking about, and there was something like 30-some% support for that very modest change, not a massive change that I think legalization is. So this thing about inevitability, even in the United States, it's difficult to make that case. Sure, there's been obviously an increase recently, where I'm not denying the trend. There has been a trend upward in the US, so the only country where there has been that. dramatic upward of almost majority. But actually, a lot of those polls are based on questions like, do you support the legalization of marijuana use? Not retail sales, which is exactly what's happening. I'd like to ask the question about, do you support retail sales across the U.S.? And I think we may get a different answer than 50-some%. You might have a bit lower than that. And now you have 2 out of 50 states that have done it. The lobby thinks they're going to have about 6 in the next 4 or 5 years. We don't know if that's true or not. In the 1970s in the U.S., we not only had 12 states that liberalized their law in a matter of 4 years, and a organization, NORML, that had front door access to the president in the late 70s, which this reform movement today does not. And even then, when the president used some of his time at his precious State of the Union address in 1977 to say that the penalties for marijuana should not be more harmful than marijuana use itself, there was a massive reversal a few years later. Frankly, people realized that they got a taste of it in some of these states and they didn't like it. They didn't want their kids using. It set the legalization movement back 35 years, and now we're where we are. So we can't predict the future. By the way, as an aside, that was President Carter who did that. And 3 months ago, President Carter endorsed Project SAM publicly in saying that he knows that what's going to happen in Washington and Colorado is going to be the inevitable commercialization based on tobacco and alcohol. And given that, he supports the SAM model. I think where he's coming from, someone as sensible as him, and other folks are coming from, is the fact that it's not a straw man when I'm talking about the tobacco and alcohol industry, and when I'm talking about the emerging marijuana industry. It is the reality. This, sadly, is not the reality in the United States right now where this is going forward. And again, it might be the reality in Uruguay. It'll be interesting to see what happens there, and also interesting when the politics could change very rapidly in a year there, whereas in the US it would be probably slower change if it were to reverse. But that is what's happening. So things like plain packaging, things like no advertising. Well, guess what? They've done the rules in Colorado and Washington. And while, yes, you can't, I think in one of the states, I can't remember which, it has to have some sort of plain packaging. When you open up the package, it can be cartoon characters. It can market to kids. There's no restrictions on advertising on the internet, which is where kids get their television. I mean, I don't know anybody under 15 in the US that watches TV anymore on a tube. They watch it on Hulu or whatever else, on Netflix, on their computer. That will be legal. And so the reality is that I get that that's not what you're talking about, but I think that certainly is the reality. So again, I would push back against the inevitability. I would also say, by the way, that the big tobacco thing is not unique to the U.S. I'm going to take offense to that because that's very extreme. But I have done research and been to, let's talk about Southeast Asia. Let's talk about Laos. Let's talk about Thailand. For those, and there are a few people maybe from there that have been there, you know that the tobacco advertising you're seeing in Malaysia, Laos, Thailand, China, Africa now, is the exact same stuff that was used 40 years ago in the US, showing doctors prefer Camels and physicians prefer Pall Malls or whatever. Those are literally being recycled in the developing world. So it's not an American phenomenon. If anything, America has led the way in terms of restrictions, yet we still have 1 in 4 people using cigarettes. And now not 500,000 people dead, 400,000. I mean, this is in a country in the US where you cannot smoke anywhere. I mean, I've seen much more smoking when I travel abroad. Even smokers hate smoking in the U.S. I mean, they hate the fact, they don't want to be smoking. They're addicted, they are. Certainly their spouses and their kids, because your house is the only place you can really smoke in the U.S. anymore, literally. And their spouse and their kids usually will kick them out for that. So there really is nowhere. You can't have a more restrictive legalization regime now as you do in the United States, where that advertising has been voluntarily pulled for a time being, but actually is still seen in magazines. You still have Vogue and GQ and other magazines that advertise tobacco, even after the settlement and after everything that we've had. So again, we've sort of had our chance to do it. There's no way. You're right in the fact that once this gets going, and it will be out of our hands, because it's in the hands of industry and the billionaires funding it. I mean, it is out of our hands. And once it gets going, it will be really difficult to put back in the box. I don't know anybody in the public health world who will tell me that alcohol legalization from a public health perspective has been a success. I mean, it's just, but nobody's arguing, including myself, I'm not either, for alcohol prohibition. You can't go back to 5,000 years. And so again, I think once we introduce it and it sort of the cat does come out of the bag and the market forces or government forces, again, just as bad for R.J. Reynolds to make money off addiction as it is for the state of Washington in my book. And so even very careful observers like Mark Kleiman, who I disagree with on many different things and agree with on some things, who was the consultant to Washington State, and if you didn't read the New Yorker article about Washington's process, it's very, very interesting and enlightening, just sort of laying out the facts. But when he's up there saying, look, you're a liquor control board who's supposed to be controlling marijuana, you don't want to be increasing use because you think it's good for revenue and you're going to get money. That actually isn't a good thing. We actually want to minimize use in a regulated model. Well, with a government that is trying to make money and with advocates at every single meeting, that wasn't able to happen among probably, despite one of the smartest people in drug policy worldwide, giving them that advice and frankly being paid almost $1 million to give them that advice. And so, again, it just comes down to the fact that we would all agree that there are certain things that should or shouldn't happen and we can agree with over tea. But these are the forces that are happening. This is what's going forward. This is the example that we have. And I just don't think it looks good. It doesn't mean I think prohibition looks good. I hate the war on drugs too. Well, let's fix it. It's not a choice between the death penalty or legalization. That's ridiculous. It's a choice between how, in a context where, yes, it's illegal and that produces harm, but it also produces the fact that fewer people use. It produces the fact that it should be a little harder to get and more expensive, most definitely, than it would be legally. That also drives down use because use is sensitive to price. Let's fix it within the current framework, get rid of the stuff we don't like, as opposed to tear down everything and open a box of which we don't really know what's inside. Thanks.
In my life have mostly been women, and it's a sad reality of this days we live in. There are